This is the first time Shaista has been able to talk to her father since he was admitted to an isolation ward for COVID-19 patients in New Delhi. Although he hasn't recovered yet, she says a video chat with him has put her and her mother at ease.
He said he's feeling better and he's also getting his medicine on time. We're also feeling immensely relieved.
The service was set up by doctors at the Lok Nayak Hospital. They say it's helping patients and their families better cope with the disease.
Most of the times relatives are not aware how is the condition of the patient. We are not able to explain it to them also. So it's better to see them with their own eyes. And I'm sure with this psychotherapy, the patients are getting relieved, they are getting better, and the relatives are also very happy.
The video chats were started as India sees a surge in COVID-19 patients. Cases have risen sharply since a nationwide lockdown was eased in June. More than 1,000 new cases of the virus are emerging in the country every hour. So far, about 700,000 people have been infected and nearly 20,000 have died. That makes India the third worst hit country after the US and Brazil. Southern states like Karnataka, Andhra Pradesh and Tamil Nadu, which initially managed to limit their outbreaks, are now seeing a resurgence of the virus. And another week-long lockdown has been imposed in cities in Kerala state. Similar breakouts are forcing lockdowns in many other parts of the world. In Australia, the borders of the state of Victoria are being sealed indefinitely to contain an outbreak there from spreading to the rest of the country. La Marina County in northwestern Spain is under a week-long lockdown after new cases were reported there, and cases are rising in 39 of the 50 US states, raising pressure on governments to reimpose restrictions.
We really do have to double down on the control measures that we have at our disposal. We need to suppress infection, we need to reduce mortality.
Many of these places had lifted lockdowns to minimize the economic fallout of the pandemic. But if they can't slow down the spread of COVID-19 soon, it could take an even greater toll on lives and economies. Mobin Nasir, TRT World.
Well, for more on this, Sunil Poshakwale joins us now from Birmingham. He's an international finance professor at the Cranfield School of Management. Welcome back to Money Talks, Sunil. Now, as we know, India had one of the world's toughest lockdowns when it was imposed in late March, so much so that when it was suddenly announced, it left millions of mainly poor migrant workers stranded across the country. Why then, seeing as though they went through all that trouble, are we seeing a rise in the number of cases now?
Well, I mean, it's just the enormity of the country. I mean, you're talking about a country with 1.3 billion plus people. Obviously, it's a country of a size of a continent. And given the nature of virus that we know it is, that it can spread very quickly and without actually noticing it, it's not surprising that the numbers of cases are rising. Now, the workers, of course, were persuaded by the government to stay where they were, but obviously there was a panic, and all the migrant workers decided to go back to their states, and obviously that may have also been a contributing factor into the rise in number of cases. Having said that, if you look at India's numbers in terms of death per million, it is among the lowest. It's only about 15 or so compared to Russia. I think it's about 70. But also, what is more remarkable, and obviously I'm not a scientist, so I can't say what the reasons are, that the recovery rate from the coronavirus in India is amongst the highest. It's about 58 to 60%. So that is a very good news. And therefore, hope is that even though the number of cases are increasing in India, with the good recovery rate, the number of death toll in India would be somewhat less.
Okay, now the idea behind a lockdown isn't just to curb the spread of the virus, it's also to spend the money in order to beef up the country's hospital resources to deal with coronavirus cases. Has India managed to do that?
Oh, I mean, I must say that, that this government has been extremely proactive in terms of trying to help in every way that they could, right from the point of view of imposing quarantine. India was amongst the first to do so, starting to actually proactively build hospitals, starting to manufacture the personal protection equipments. They have become one of the largest producers of PPEs, something which even advanced country like UK struggled to cater to their medical staff. And on top of all that, on the economy front, the government took huge steps has launched schemes after schemes. In fact, one of the latest bailout packages, in a way to help the poor particularly, is worth about 260 billion US dollar plus. So all in all, the government has been extremely proactive. They have been trying to ensure that the poor people are provided the food and the necessities that they need to survive. But it's been an extremely big challenge for this government.
Can I ask you about the world's biggest coronavirus hotspot now, the United States? Now, Texas and Florida have reported new record daily spikes in infections. California, Arizona, and several other states are reporting similar things. How does that threaten the economic recovery, not only of the United States, but around the world?
Well, I mean, the economic recovery around the world will remain fragile. As we know, there are lots of commentators who are predicting the world economy to shrink. And the hit could run into billions, if not even could go to trillions. So we know that what is happening in terms of the impact of the coronavirus, the economic impact of coronavirus, is going to be absolutely huge. Having said that, I mean, I'm cautiously optimistic about going back to the Indian economy case, that India will be able to bounce back because primarily its rural economy has not been as badly affected as its urban economy is. And there are some very good signs that the rural economy might actually help in economic recovery in India.
Okay, Sunil Poshakwale from the Cranfield School of Management, thank you again for joining us on the program.
Pleasure.